Hello everyone, let's talk today about the hypothyroidism and hyperthyroidism manifestation, that how these disease manifest and a proper mnemonic for it. But before going to that, first of all, remember that how the normal regulation of the thyroid gland how the normal regulation of the thyroid gland occurs. So first of all, you know that the hypothalamus secretes thyroxine releasing hormone, and that act on the pituitary, and then the pituitary releases thyroid stimulating hormone. Now this thyroid stimulating hormones, that via blood, since it is an endocrine gland, so it reaches via blood to the thyroid gland. And in the thyroid gland, what happens, that the thyroid gland then produces T4. That mainly it produces T4, but a small amount of T3 is also produced, but just for now you remember that it produces T4, and then T4 in then converted into T3 by the target organ or the peripheral organ. So it is mainly the T3 that is the most potent hormone. Okay, so this is the most potent hormone that then acts on various body functions, and that increases the functions of the various body tissue, and that we will discuss shortly. But for now, just remember it. And now, how the negative feedback mechanism work, that the T4 then inhibits the pituitary release of the thyroid stimulating hormone, as well as hypothalamic release of thyroxine releasing hormone. Similarly, the TSH also negatively feedback to the hypothalamus in the secretion of the thyrotropic releasing hormone. So this is the normal regulatory mechanism of thyroid gland. Now, a few terminologies that are worth knowing are the first of all the hypothyroidism. So, hypothyroidism is basically the decreased level of T3 and T4 in the blood. The hyperthyroidism is actually increase in T3 and T4 level, but this increase should be due to this increased synthesis of the thyroid gland. So now you separate it from thyrotoxicosis. Remember, in hyperthyroidism, the source of the gland should be thyroid gland. But in the thyrotoxicosis, it is actually the clinical manifestation of increased T3 and T4 levels. And this increase in T3 and T4 level may be due to any reason. And the source is not definite. That is, the source is irrelevant to the cause. So just remember, whenever there is increased T3 and T4 level due to any reason and they clinically manifest, so that will be your thyrotoxicosis. Whereas for hyperthyroidism, you must have the source of increased synthesis of the thyroid gland. So you can say that all the hyperthyroidisms, so they are thyrotoxicosis, but all the thyrotoxicosis are not hyperthyroidism, since some other sources may also produce the thyroid gland. Okay, now let's cover some of the manifestation of the hyperthyroidism, that how hyperthyroidism will present, and it is also called as thyrotoxicosis. So first of all, you know that normally what happens is that normally when the thyroid gland is stimulated by thyroid stimulating hormone, it produces mainly T4, some amount of T3, but just remember T4, and that T4 is then converted into the by the peripheral organ into the T3. Now this T3, what it does is mainly two functions. It first of all increases the sodium potassium ATPase synthesis. So increase sodium potassium ATPase synthesis, and you know that this is the sodium potassium pump that is present in the membrane of the various tissue, and it maintains the regularity, and it brings in sodium and push out potassium. So this is your main pump, that synthesis is increased. So due to the increased synthesis of this pump, the BMR, the basal metabolic rate, increase. Mainly you can say that all the functions of all the cells, they increase due to this increase in this pump synthesis. What happens, that all the functions of all the cells, that increases. And what it's the second thing that T3 does, that it increases the sympathetic response. So you will see the various sympathetic symptoms, and you will also see the various functions that are increased in hyperthyroidism and decreased in hypothyroidism. So you know that thyroid is thus essential for your normal functioning as well as development. If the body isn't developed yet, say for example, if there is a child, so what will happen if the thyroid hormone decreases, so that development will also be stunted. That we'll see a little bit later. Now first of all, now the mnemonic and how does the hyperthyroidism present. So you just have to remember the manifestation of hyperthyroidism right from the start right from the top and go all the way down. So first of all, you see at the head, you see the CNS system. So in the CNS, the hyperthyroidism, how the hyperthyroidism will manifest, so all the functions will increase. So what will happen, the patient will have anxiety, insomnia, and heightened emotion. Okay, now the second thing, you come to the forehead. Now here you often see the athletes clearing their sweating. So in the hyperthyroidism, what will happen, since increased basal metabolic rate, so these patients will be producing more and more heat due to increased consumption of their energy. So what will happen, that they will be heat intolerant and they will have increased sweating. Now increased sweating will also be due to the increased sympathetic response. The sweating is controlled by sympathetic response. The third thing, that they will have stirring gaze and lid lag and lid traction. So this is the main symptom of the hyperthyroidism. You will see in all of these patients that they will have staring type of gaze, and they will have lid lag and lid traction as well. Now they will also have hyperglycemia. So thyroid hormone is also one of the hormone that is diabetogenic, so it increases the glucose level. Okay, since it increases the burning of the energy, so it also increases the glucose level for the body to cope with it. Now it can also, due to the sympathetic response, what will happen, that tachycardia, arrhythmias, and atrial fibrillation will also occur. Sorry about that. Moreover, so you came all the way from the top, then you go to the sweating. After sweating, you came to the eyes, and in the eyes you have staring gaze. After that, you come to the neck vein. In the neck vein, there will be increased glucose, so that is your hyperglycemia. Now you reaches the heart. In the heart, you have tachycardia, arrhythmias, and atrial fibrillation that can occur. Now you go to the upper limb, you have biceps, a little bit biceps, so that biceps will show you the muscle mass. So the muscle mass will be decreased in this case, because all the body is utilizing more and more of energy. So there will be decreased muscle mass, there will be weakness and weight loss, since the body is burning all its energy. There will be hypercholesterolemia. You come down to the tummy, so here you will have hypercholesterolemia and diarrhea. So diarrhea is due to the increased motility of the gut, since gut is also utilizing large amounts of energy, so it will be producing a large amount of peristalsis, hypermotility, and that will lead to diarrhea. Moreover, in the female patient, now you come the way down to the pelvic area. So here the patient will have oligomenorrhea, females will have. And moreover, when you reaches the femur bone, so that will be you can remember it, that there will be bone resorption with the hyperglycemia, that is increased osteoclast activity will occur in these patients. So just remember from the top to the bottom all of these symptoms. First of all, we said that anxiety, insomnia, and heightened emotion. Then at the forehead, we said heat intolerance and increased sweating. Then there will be staring gaze and lid lag. Then there will be in neck vein hyperglycemia. Then at the heart, there will be tachycardia, arrhythmias, and atrial fibrillation. At the muscle mass, there will be decreased muscle mass as well as weakness and weight loss. Then you reach the tummy, and then it is hypercholesterolemia and diarrhea, then oligomenorrhea, and finally bone resorption and hypercalcemia, that is also related with hyperthyroidism. Now let's move to the